Welcome my dear friends to this week's video. If you are an international dentist and you have been thinking of coming to the UK for masters, you will be glad that you watched this video before you actually accepted the offer to come. I know I would be if I knew the information I'm going to share with you today in this video. I would have never come to masters in the UK, or maybe I would, depending on what kind of interests I would be having. But if your interest is to come and practice dentistry, clinical dentistry in the UK, then I'm going to share with you seven reasons why you should not apply for masters as a means of coming to practice dentistry in the UK. So welcome to this video. Take a seat and let's go. Welcome back, my friends. So the very first reason is that a master's is not what you need if you're planning to come and practice dentistry in the UK. And I'll explain. First of all, we all know that in order to practice dentistry in UK, you must be GDC registered. You must be a dentist who is registered by the GDC to practice in the UK. And that master's that you want to do, however impressive it may be, it does not replace licensing exams. You still have to take these exams. So that means what you really need to practice dentistry in the UK is ORE, LDS, or temporary registration, a license from the GDC that allows you to do so. The master's degrees that are aimed at international dentists do not give you a GDC registration. So clearly, the master's is not what you need. What you need is a GDC registration to practice in this country. What's more is that once you apply for this master's, you are going to study by simulation. That means that depending on the time your master's takes, you will spend this entire time without touching a patient. And if you're in clinical practice, you know what that means. Having to spend all this time without being in touch with the patients in the clinic will somehow cause you to lose your skills. Yep, maybe not much, not several, but yes, to some extent, when you get back to the clinic, you'll realize that definitely you have some rust shed off. Yeah, so clearly, this master's is not what you need. Just focus on ORE, pass the exam, and come and practice. The second thing is the cost. Most master's degrees for overseas dentists are costly. Unlike other disciplines where there are master's degrees of, say, 6,000, 7,000, 5,000, 9,000 pounds. When it comes to dentistry, you should expect to spend a minimum of 20,000 pounds, 20 to 40 actually. And that does not include your own living expenses. So we are talking about at least 40, 50, around there, £1,000 for a single master's. That, as I have said earlier, you won't need. So assuming you actually have this money and you decide that you are going to invest this money in preparing for ORE exam or LDS, whichever you have chosen, and you get your visa for 6 months, come and prepare for this exam. How much do you think you will spend? Well, we don't know, but my guess is it will be a tiny fraction of that money that you would have spent on the master's degree. So even by comparing the costs just, you can see that the difference is huge, but you don't stand to benefit from the master's. And if you actually have all that money, that means that you can enroll into a preparatory exam of very high quality and you get the best preparation. And that also will translate into passing highly or passing on first attempt. So if you have that money, in my opinion, it is better invested into an ORE preparatory course than having to take the master's. That will not benefit you anyways. The third point is, but before we go to the third point, If you are new here, please make sure that you hit the subscribe button. And if you are finding value in this video, or if you find value in this video after watching up to the end, please make sure that you give it a like and share it with all your friends who might benefit, because I wish I knew this information before I took on that master's. But you guys have the chance to get this information, and you can share it with others and let them make their own decision whether to take the master's or not, but when they have full information. So the third point is time consideration. Well, we know that a master's for dentists in UK takes a minimum of 1 year, but in most cases it can go up to 2 years. Now, these are 2 years you are spending on intense study, and you're going to get a master's which you are not going to use to get employment without the ORE exam. Why the time aspect is important here is this: while you are doing that master's degree, you have little to nothing in terms of time that you could invest in preparing for ORE or LDS exam. So that means you're going to spend this entire time studying that master's. After that, you will still need to prepare for this ORE exam and pass it if you want to practice dentistry in UK. So let's assume your course takes 1 year. So that's 1 year you have put aside. Then you're going to prepare for ORE. ORE 1 and 2 probably will also take you 1 year if you are lucky to get the seats and pass on first attempt. It will take you 1 year to complete, so those are 2 years. If you don't pass the first time, then you know the time increases. Whereas if you focused all your energy to prepare for ORE, then you only have that 1 year. And as I mentioned earlier, if you have the resources and you invest the resources into preparatory exams, then your chances of passing are high. Then you get to save on time. We shall come later to why time saving is really important. The fourth point is that it has limited benefits. I think I have hinted on this earlier when I said it's the master's you don't need. Here is the reason. Even after getting your GDC registration, employers in the UK will not give you a job because you have a master's degree. No. Here, what they consider is that other than having a GDC registration, do you have a UK work experience? And remember, you cannot get this UK work experience through your master's degree. You actually have to get employed and get a job. So your master's degree does not count. It will not earn you a job, neither will it earn you a higher pay. It's irrelevant when you start working. So it only looks good on your CV, and if that is something that you like, yeah, by all means go for it, but don't count on it when it comes to employment or pay. It does not lead to better pay or better employment. Next, let's look at the issue of settlement. Well, most of the dentists, or let's just say immigrant skilled workers, have an intention of settling in the UK, right? However, when you come with your student visa, all the time you spend studying does not count towards your settlement. What's more is that since you are focusing on studies, it means that by the time you complete, you are not ready to switch to a skilled worker visa. Why? Because you are not GDC registered. So most likely you are going to apply for post-study visa, what they call the graduate visa, for 2 years. That visa, much as it helps you by giving you time to prepare for your ORE, the 1 year you spent when you're studying your master's, plus the 2 years that you spend on your graduate visa, 3 years do not count towards your settlement. Yes, now that means that When you finally switch to the skilled work visa, it means that you are starting to count the 5-year time afresh. You're starting from zero. So if I did ORE and came on my skilled work visa straight away, it will take me 5 years to settle, to get permanent residency. Whereas if you decide that you're coming to do your master's, you do your master's, then you get graduate visa, it will take you 8 good years to settle. If there's something that you want, by all means, come for your master's and get ready. But if you want to settle as soon as possible, yeah, I would say focus on your ORE or LDS and come and settle. The 6th issue is the issue of visa complications. When you come on your student visa, it has restrictions. And one major restriction is that you can't work for more than 20 hours a week. That may not be an issue for people who come when they are fully prepared with their funds, but for those who somehow need to supplement their finances, this becomes a big issue because you need to find employment. And trust me, getting employment for 20 hours a week is an uphill task. Almost no employer wants to employ a part-time worker because that means they will have to employ another person for the same job for the time when you are not at work. So what they prefer is to employ one person who is going to work full-time. So you will really struggle with this. And when time comes and you get a job and you want to switch, as you know, the rules changed. You can no longer switch to a skilled work visa before completing the course. You need to complete the course, then you can be switched to skilled work visa. Whereas when you come after completing your ORE or LDS and with your GDC registration, you are straight away going into skilled work visa, working full-time if you wish, if you can work part-time if you wish. But the issue is, it will be much easier for you to get a job because you are available to work 40 hours a week. So the employer does not need to have more than one person for the same job. Finally, a master's degree actually has better alternatives, which I didn't know about when I came for my master's. For example, you could do membership exams, you could do fellowships and become a fellow or a member. These other alternatives actually will give you a better job and a better pay when you finally get GDC registration, because you can actually do these fellowships and memberships without a GDC registration. So when you finally get your GDC registration and you have these memberships and fellowships qualifications attached to your CV, they weigh more than your master's. Actually, master's doesn't mean anything, but those do mean a lot of things. And it will give you better pay, it will give you better job prospects. So if I were you, I would look them up and then go for those instead of doing the master's degree. The reason why that is so is because most of these focus on practical aspects of dentistry, whereas most masters for overseas dentists are theoretical. Most are based on research, which is a good thing if you're planning to be a researcher or you are planning to progress into a PhD and then start lecturing at the university. Yeah, and then that makes sense. But if you are focused on clinical practice, your interest is mainly clinical practice, then the master's doesn't do you any good. I hope that I have given you enough information for you to make an informed decision, so you know exactly what you are going into before going for that master's. This is the information that I wish I had before, but I didn't. But I'm glad that I can share it with you. Thank you for watching. See you in the next one.